We've got a great opportunity to think really differently about how we approach health and well-being for children and young people in this country.
If you want the best start in life, you want healthcare professionals to work in a more integrated way around the health of our children and their families.
I think it's really clear to me that as paediatricians we need to think and behave differently about the way we work. We need to connect with other professionals we work with. The GP and the GP practice is a really key locus of that for us. There's a great place for us to build relationships, and in doing that what we've found is it brings in other colleagues, so health visitors, school nurses, colleagues who work in a mental health setting, community-based dietitians, and indeed colleagues who work in a third sector setting can come together around the GP practice to work together, to think together and to learn together for the benefit of children.
We work in a really vibrant part of West London, very multicultural, multi-ethnic, brings its challenges but also has so many advantages as well, with lots of different communities coming together and supporting each other. And actually this particular part of town is the most deprived in London itself, which clearly brings its challenges. Child obesity is a growing problem. In North West London, 1 in 5 children are overweight. We are now working in hubs which brings together professionals from primary care, the hospitals and in the community, and we are looking at all aspects of our children's needs and able to find and create support for all of those needs, and that's naturally going to have a really tremendous benefit.
I've seen patients' care transformed by the GP hub. Children that were coming into A&E once a week who, having one appointment in the hub, stopped coming. If you look at outpatient activity, we've taken 80% of hospital appointments out of the hospital. About half of those are being seen in the GP practice, face to face, and about half don't need to be seen at all. What we see is that families feel much more able to look after conditions themselves, and GPs feel much more confident and able to manage patients themselves.
I used to work as a local authority social worker, and something that I found really frustrating in that role was the lack of information sharing between professionals. We're all there trying to safeguard children and families, and it's really great to have a space where people feel comfortable to share information.
The child health hubs are a really good place to discuss your concerns about specific pediatric patients that belong to the GP surgery. In turn, with all the other health professionals that are there, you could have more integrated care and a better outcome for the child.
An example is, say, a child with maybe epilepsy. If I see that child with the GP, I might then find out that there's another problem. Maybe the child is living in temporary accommodation, or the mother has a mental health issue. Things that I wouldn't know if I was seeing the child in the hospital. And because I have that added insight, I can provide advice and guidance about managing the epilepsy that is very tailored to that child's individual needs. It's much more personalised and therefore much more effective for that individual child and family.
For me, I feel like I'm the link between the professionals, health professionals, and my community. I became a practice champion for White City after one of my children became seriously ill, ended up in hospital, but I didn't tap into the emergency care that he needed when I should have. And it hit me. I wasn't educated enough. I didn't know much about his asthma. And what hit me hardest was when he was actually taken into hospital, that I was actually using the inhaler incorrectly.
We are now focusing on the whole child, looking at prevention, early intervention, and helping patients and families better manage the child's health, not just from the medical aspect, but also their emotional health and their mental well-being.
As people who work in the NHS and work in healthcare, we've got to start to behave very differently about the way we interact with our communities. We need to make sure that our hospitals are very good and that when people are seriously unwell that they get great care in that setting. But we have so much more to offer that really reach out into people's lives in a meaningful way, and that's about thinking and working differently.
Our normal starting points in the consultation used to be what's the matter with you, and now we can ask what matters most to you.
This model gives us a really good example of that. We need to get on and scale it up. This needs to become the way we work.